up to 1:30.
Good afternoon. Good afternoon. Dr. Terry Jacklin here. I'm a naturopathic doctor, functional medicine practitioner, and someone who's lived with MS for over 30 years. I'm delighted to still be here in the Cowichan Valley, visiting Dr. Bill Code, who is going to speak to us today on a topic that is becoming more and more prevalent in the news and in the alternative medical world, and that is the therapeutic use of cannabis. Dr. Code's background is in anesthesiology, so nobody knows brain chemistry better, but he also spent 6 years working with chronic pain. So you've got lots of experience in that world, and why don't you start by telling us how cannabis can be used therapeutically in MS?
Sure. Well, just to take it back a little bit, you've got more than 30 years with multiple sclerosis. I'm now more than 20.
That's right. Forgot to mention that.
And it's a very valuable tool to have something such as cannabis because it helps several of the problems of MS.
Okay.
And I'll try and go through how those might be, and then I'll relate again back toward chronic pain itself. So the 4 issues in MS which can be helped with cannabis with some variation of strength of CBD and THC are, of course, pain, neuropathic pain of MS, which is about 70% of us have, migraine headache, which about 70% of us have. The other issue is muscle spasm, quite debilitating sometimes. And then the 4th one would be sleep, because not having optimal sleep really diminishes our ability to recover. So the good thing about turning early to cannabis for any one of those 4 problems, it reduces many of the other drugs that you might need to use. Mm-hmm. So let's talk about spasticity first. That's probably where the very best research is. Double-blind controlled trials. In fact, GW Pharmaceuticals put out a agent which is half CBD, half THC, which you can spray in the mouth under the tongue, a little bit like you would spray nitroglycerin if you had a heart pain and so on. And that is for treatment of spasticity. And they put that...
Is that a pharmaceutical?
That is a pharmaceutical, which is available in 29 countries now.
What's
so
it
for
called?
Quite a while. Sativex,
Yeah.
Sativex, okay? So that's the prototype for those of you who are unable to get a medical license for marijuana, because that depends where you are physically. Sativex is not yet available in the United States, so many people in the United States, if they want to use cannabis or medical marijuana, hopefully they live in one of those 28 or so states that have now approved that use. Right. So spasticity, of course, in my mind, is something that the brain is partly injured, so the message to send down calming or relaxation to a muscle is not properly working. Right. Consequently, when the muscle goes into spasm, it stays in spasm, and it's really rough. And almost all of the drugs that we use to treat that either make the patient very sedated or actually weaker or both. Right. So that's a very big advantage of using cannabis for this, because you can maintain your muscle strength. Because I see way too many people who lose their ability to walk, which is partly, unfortunately, secondary to the drug side effects.
Wow. Not
of the cannabis, but of the drug itself, whether it's baclofen or a whole host of other agents. They have a downside, and that's one of them. The other feature that works in with that, and then I'll go into the issue of the feedback loop with regard to the chronic pain. Chronic pain is also perception of pain within the brain. So when you get your initial pain and the acute injury, it of course goes up from the hot stove in the periphery, goes up to the brain. But when that pain has happened enough times, or is due to actually a mixed message in the brain. My worst one early on was it felt like my left leg was broken, midway between the knee and the ankle. Yeah. And it was really severe. Fortunately, it only lasted 20, 30 seconds. And I eventually learned I could help minimize that if I gave up gluten. But the problems with pain in MS are legion. Again, it's 70% of people in that group, same as it's 70% with migraines with some major overlap. And it's a very good way to treat that chronic pain. And people will start low and they'll work up. So to get the pain treated, the optimal ratio suggested is often to begin with a 4 THC to 1 CBD ratio. Okay, 4 to 1. So those
For
are relatively
pain- for
harder
pain.
to find for
Yeah.
pain.
Okay.
Yeah. And you could start with that one, and you can do it a number of ways. Because now you can, in Canada, purchase from licensed producers, or if you've got the ability to grow your own, or have someone grow for you, then you go for strains. You may not find a 4 to 1 strain, but maybe you can find one that's high CBD. So then you would mix in some with one with a little more THC until you're roughly at that ratio of the two. The other benefit of using the whole plant is you're getting the other subtle effects of the other components within it. And those are often called terpenes. And there's 4 or 5 of those are especially critical and helpful. And we'll talk about 1 or 2 of those as we move on. So in summary then, for pain or headache equally, because that's pretty much pain and it feels chronic when you've had it more than 3 months, and I'm now 25 years or more. And so if you can go with some of that relatively early, it will work better for the headache. The other thing we know now, and this might surprise some of you, is we know now that acetaminophen, or Tylenol to some of you, or paracetamol if you're in the UK or Australia or New Zealand, then those actually work on the cannabinoid pathway in the body. And so does the non-steroidal anti-inflammatory drugs work partly on that. But the downside, of course, of both of those groups of drugs, and there was a time I swallowed a bottle of each per month.
Ouch.
Not good for my kidneys or my liver.
Or your gut.
Or gut too.
The
Leaky
microbiome
gut as well.
suffers, absolutely.
Messes all that up. So now I break through, I would maybe do 1 capsule of 1 per month.
Now.
Yeah.
Right.
So if I can get away from those, my gut gets healthier. Secondly, my brain gets healthier.
Now, Bill, can I just interrupt you to ask a question that appeals perhaps to your anesthesiology side? When I first started to practice in Waterdown, there was an old country doctor. She's now passed away, but she said to me when I was consulting with her on an MS patient that the only solution to neuropathic pain is medical marijuana. She said there's no pharmaceutical that will really touch it in the same way in MS that medical marijuana.
And she was absolutely correct.
Yeah.
She was way ahead of her time, because now we've worked out the pathways of how it works.
Right.
And the other thing that we worked out first in 1964, Professor Meshulam in Israel mapped out the first starts of the anandamide, which was the CB1 endocannabinoid. So let's just talk what is an endocannabinoid. Many of you will know about the opiates that we have within us. We've heard of the beta endorphins, of the exercise high, or beautiful music high. That's beta endorphin or methamphetamine. So those are made inside the body. Similarly, we also have, and it's a very, very old system in the body, much like the opioid system, we have cannabinoids made inside the body.
Okay.
And the first one was called anandamide, which in Sanskrit meant bliss.
Okay.
And the second one was called, 2-AG. It's a long chemical name, but 2-AG is simpler. And anandamide works on the CB1, cannabinoid 1 receptor, also discovered by Dr. Meshulam in Israel. And then the 2-AG acts on the CB2. Almost all of the CB1 effect is on neurons within the brain and within the periphery, so out in the arms and so on. And it's one of the main factors of its action that makes THC act very much like anandamide, which is inside the body, acting on the CB1 receptors. And by acting on it, it makes a feedback loop, and that's part of reducing the pain. So the other thing that's the primary other component within marijuana, or cannabis, you can use the names interchangeably, is the CB2 receptor, and then the other component that's in cannabis. It'd be easy if it was just one that worked on CB2, but it's not that simple. So
Never is.
no, so the CBD or cannabinoid component, which we're trying to have in that 4-to-1 balance, it acts two ways. It takes away the high, the very trippiness of the THC, so that in the cannabis naive, that's a very important thing to do, because there's pretty significant side effects when you first start using it if it's THC only, so don't go there.
Right.
Have the CBD, because it has a balancing component. The other benefit it has, it prolongs the pain relief component of the THC. So if people were taking it for instant pain, then they might use a vaporizer pen or some other version, or that spray we talked about earlier would be another quick version.
The Sativex.
If you're taking it, the other moderately quick way is to use the liquid oil made from cannabis and put it in the mouth, because now it's being absorbed almost directly into the body, much like we would do B12 under the tongue, much like we would do something else.
What's moderately quickly mean? So the
15 to 30 minutes.
Okay.
Okay, instead of 2 or 3 minutes, which you will do with the vaporizer, because it's in the lungs with that football field size, surface area for, same as we use it for anesthetics. It's much quicker, but it doesn't last as long. It will last 30 to 45 minutes. The one under the tongue, or in the mouth area with the oil will last maybe an hour or two. But if you can plan long term for the ingestible, meaning you're using it regularly to prevent the problem,
got a strategy,
then it will take 30 but often 90 minutes to work in the gut, but it will last 60 hours or longer. So that's the benefit. So when people are new to this concept or product, the place to start is in the evening at night, an hour or two before bed. Because if you've got more THC than you do CBD, or you've got 1-to-1 CBD to THC, those are best in optimizing sleep. Most chronic pain, if it keeps us awake, is a disaster and bothers us a lot more when there's no stimulus around. There's nothing to distract us.
It's the only thing we focus on then, right?
Of course, and so it tends to be a real problem at night. I have also found over the years that almost all spasms are worse at night. Okay? And so people when they start to get to bed. And so for many years I've tried to use magnesium for that, but it doesn't always work. And so then it's the next place to go to, or if your spasticity is worse, much better to go there. So it's part of the mobility challenge of MS, but if you're treating with cannabis, remember, you're more likely to stay mobile. Because the antispasmodic drug tends to rob your muscle strength and sometimes even secondarily balance. So that's why it's a trade-off.
So I have two questions, Bill. The first one is there an anti-inflammatory component to this as well?
Well, there is in a fairly major way, and that's why it's probably healthful for us to be on this herb regularly if we have a chronic inflammatory illness. Certainly everybody agrees with MS that it's a chronic inflammatory illness, but so is osteoarthritis, rheumatoid arthritis, systemic lupus, probably fibromyalgia, probably chronic fatigue syndrome, Lyme, and even cardiovascular and heart disease. Those are inflammation-based. So the anti-inflammatory part itself. Most of the anti-inflammatory benefit comes from the CBD part, CBD component. Some of it also comes from those terpenes, but I think it's maybe a little bit extended to do the terpenes today. I was lucky enough just this weekend, I was over at UBC where they had a conference on hemp and cannabis, talking about the details, and we had some of the experts in the world. One of the key ones is neurologist Ethan Rousseau, who lives down in kind of the Seattle area, but he's written a large number about these different components. And the very first prototype for testing these was multiple sclerosis. So it's good to have, as a prototype illness, the most is known about it. Correspondingly, if you use it also for the sleep component, why not get all the benefits you can from it? So now almost all of the major irritating symptoms of MS, maybe except fatigue, but these others are all helped with cannabis quite a considerable amount.
I've got a bunch of questions rattling around in my mind, but one, while the thought is still there, I just wanted to address smoking marijuana, because it's my understanding that once you get, so vaping gives us about a 200 degree
Yeah, somewhere in there.
And smoking is actually in excess of 400 degrees, and it's when the medical marijuana is smoked, or any marijuana is smoked, that the carcinogens are activated.
Yeah.
So there's the carcinogens that are involved with smoking are not involved with vaping or taking the oil.
No, they're not. And so almost everybody has moved away from this early on toking method, which came about to some degree because of the history of cigarettes, and even the combination that some people will use to make it more palatable, or they understand it better, they will mix it with tobacco.
Right.
Okay? Tobacco has its own purposes
Issues.
and so on, but the big thing about vaping it is it's quick onset, and yet you don't get any of those injurious peepers. We know that even using smoking of toking is very minimal risk, but there is some risk to it. And the other thing, while we're talking about the lungs, is we know that cannabis actually is bronchodilatory, meaning it makes the airways bigger.
Nice.
So even though smoking it in the regular early fashion would be a bit irritating to the airways, because it is, the benefits are far outweighed, especially if you're ingesting it or vaping it, because it opens the airways up. So an MS person or a person with asthma, which is inflammation of the airways, will still benefit from the anti-inflammatory opening up the airways benefits of cannabis.
Okay, very interesting. Another comment that I'd like to make is last year I had about a 3.5-month run-in with some neuropathic pain for the first time in my 30-something years with MS, and it was out of this world. Like, I was in quite a state, and I was able to access some medical marijuana and used a high CBD, and I'll tell you, I've never felt anything as soothing as that in my life. My question to that is it habit forming? Can it be used over the long term, or should you take therapeutic breaks from it, or?
So there's 2 or 3 answers to that question. It's a very good question. Addiction to marijuana is pretty uncommon. It's about 9%, okay? So that's much lower than alcohol, which is nearly 30%, narcotics or opiates, which would be 50%, nicotine, which would be 70%, you know, so it's way down in the spectrum. The other advantage is you can just withdraw on it. You have a 1 or 2 days of being unpleasant, but then you're pretty quickly okay again. So it doesn't have the addiction downside that many of these other items do. Okay. The other thing that we know that occurs if people are regularly using it day in and day out, 7 days a week, eventually they often build up some tolerance.
Okay.
So the tolerance can be removed by being off it completely for 2 to 4 weeks.
So a therapeutic holiday, so to speak.
A therapeutic holiday, or what some people suggest is you take 2 days off a week.
Oh yeah.
I would tend to suggest people, well, if you can use other coping skills at home on the weekend when you're not at work, then maybe you do that on the weekend.
Right.
But whichever way works out for you, the benefits of it last a fair length of time on the body. And the other important thing to address is people getting started on it. Because there's sometimes this fear, well, what will it do to the other drugs that I'm taking? And it will do very little, fortunately, to the other drugs that you're taking.
So no interactions.
I can't say zero, but there's never been a reported case of a problem. So the only one that I would like people to watch particularly closely would be if you're on the blood thinner group of drugs.
Okay.
And then you can follow those with the ordinary numbers or ordinary symptoms with your doctor,
right.
Okay? With your MD, because they will be usually prescribing those items anyway and following with them. But in general, the most that ever happens with occasional drugs is it increases the strength of the drug. For example, if you're on one of the hypnotic Valium type drugs to sleep better or for your seizures, then you get more drowsy because those drugs last a little longer in the body. Okay. So the simple solution, reduce the drug slightly once you're too drowsy. And that's the other advantage of taking it in the early days in the evening or bedtime. Because you had a chance to bring the drug concentration down, the side effects are relatively sorted out and dealt with, and then there may come a time the spasms are more prevalent, so you're also using it in the morning. But that's okay. Start with the evening, get a hold of them at the worst time of day, and then work forward from it.
Perfect. And ultimately, what you want to be doing is working towards reducing the amount of other pharmaceuticals that you need to take, as that's possible, right?
That's my personal bias. You know, I take a thyroid replacement drug, and that's the only medication that I take of the pharmaceutical group. So that's a relative advantage, and I think a place to aim for with multiple sclerosis. I mean, and that's more than we can talk about here, but the cannabis is an increasingly important issue because it gives us another set of choices rather than 2, 4, or 6, you know, pharmaceutical drugs. It's a whole different point again whether we would be using the blocking drugs, you know, so on, but that's more time for other discussion in my book and so on.
Right.
But I think the big 4, and then the sleep I haven't maybe dealt with enough yet. Remember, it's the 1-to-1 ratio of THC to CBD, often best with sleep. You can start at an hour or 2 before bedtime, and if you're improving your sleep, then you're tending to improve the washing of the brain, or brainwash, that occurs through the night.
Right.
And that's when a lot of the healing happens in the brain. So
Definitely.
the more you can get healthy sleep. The Valium type families that we tend to use for sleeping at night don't give us optimal ordinary sleep. Okay? They take that away, and they tend to take away the REM sleep, rapid eye movement dream sleep, and they also tend to, actually we know now mostly they work by letting us forget the times that we woke up. So it's not making all that much difference to it at all, it's more being amnestic, hypnotic.
Exactly. Now, I just have a question about growing your own. So you had mentioned earlier growing your own. That, of course, is if you have the medical marijuana ticket. You don't want to just go growing your own.
Well, that's right, and so that depends very much where you live. In
Right.
Canada, we've had it for more than a dozen years, where people can go to their physician can write them a medical document, they don't call it a prescription, and then that is sent to Health Canada with an application to either grow their own, or
Right.
have somebody grow it for you, or in Canada, the third option now is to buy it from the Health Canada screened
Right.
licensed producers. We have around 30 of those in Canada. And so those are for people that, you know, they don't have any intention of developing the skill set of growing it, or maybe turning it into an oil, both of which are modest challenges, so they can go that route. And it also, for those that have a physician who will not go that route yet, then I would go back to the pharmaceutical route in the short term, where they can get that Sativex unit, and they can get that 1-to-1. Now, if you're in the United States, it will vary which state you're in, and if you're in other parts of the world, it will vary as well. Some will not have the medical marijuana route, so that's why it's important to give them a pharmaceutical option, because I think it is a reasonable way to go, because you can titrate, meaning move up and down how much you're using.
Perfect.
When you're taking that spray under the tongue of the Sativex, then you're getting action within 5 to 15 minutes. You would not repeat it unless you're doing it more than 15 minutes apart, and you would stop at no more than 12 per day. So those are the kind of the guidelines in use, and that range will tolerate most issues. The other advantage for Canadians, if they're going to travel in parts of the world outside the country, then you need to probably be on the Sativex spray by prescription.
Gotcha.
Because just because you have a medical marijuana ability in Canada, it ends at our border.
Right.
I don't care whether you're going
And that's
stateside, Europe,
That's very
US,
important
Mexico.
to.
Yeah.
Right.
So that's an important issue if you want to travel.
Okay, perfect. So I'm just trying to think of some of my other questions. I had somebody commenting about the cost of medical marijuana and that it was sort of cost prohibitive. But like you said, it's a modest obstacle to grow your own, make your own. So if you have that license, you can easily do that. In fact, we were looking on Facebook, or not Facebook, on YouTube, and found a number of different videos on how to make it yourself. So it's about getting the specific strain then, right?
That's a big part of it, or adapting it around. So it was most difficult over the last 100 years. We lost a lot of the ability to grow CBDs, but fortunately those were found in Northern California.
Right.
So there is strains around with relatively higher CBD, and then you can mix and match strains in your oil, or put a little bit of this oil in your mouth, a little bit of this oil in your mouth, and then the body will mix them. Because then you're finding the benefits of each one. And if you happen to live perhaps in Vancouver or Victoria, Canada, then you may be able to try it at a dispensary. Or if you're in Colorado or Washington State or Oregon State or maybe California, often you can try it from these dispensaries and you can start to work out which one works for you. So it depends a lot where you live and certainly
and
your
those
local
people are
physician.
knowledgeable too, right? At
Oh
the
yeah,
dispensaries.
often
we have them in Ontario too, by the way. We have these
Yeah,
dispensaries.
they're not official.
They're
This
not
is going
official.
direct.
They're very much a gray zone, you know.
Yeah, and so that may get sorted out in the next year or two, because I think Canada is moving toward a place where it would be available
Legalization, yeah.
recreationally.
Right.
And so each of those is going to help it be more available for people
So-
and relatively less cost.
So what happens if I being Joe Blow MS patient, go to my physician and request medical marijuana for my spasms or pain, and that physician doesn't personally believe in medical marijuana and therefore refuses to write me a script? What are my options there?
Well, usually they will help you find someone.
They
And
will?
it-
Okay.
And if they won't,
Uh-huh.
then you can often get in touch. The pain clinics are now using it to an increasing amount,
Okay,
some of the pain
perfect.
clinics. Or you can now go through a friend or a contact online and find a cannabis significant thing,
Right.
okay? So if
Thing
people
being
are,
dispensary?
no, not dispensary, a physician who's
Oh, gotcha. Who's
consenting
willing
and
to?
willing to
right. Okay.
interview you, take you
Yeah.
on as a client, whether it's as an integrated medicine, functional medicine client and use it, or consultative client, whichever way that they decide to do it. And so, for example, one of the centers in the country, Greenleaf Clinic out near Langley, BC, are online, and they're very good at helping match people with someone if they can't access it another way.
Perfect.
So those are recognized issues that happen
Good stuff.
here and there across the country. A little more accepted in BC, certainly, has been for quite some time.
Well, of
We're in
course,
British Columbia today.
BC's known for their BC bud, right?
Well, that's right. It's a famous because it's climate's easier and there's been more of
Everything grows.
moving forward.
Yeah.
Same as it's been a lot down the west coast of the United States, and not surprisingly, some of the most open-minded, forward-thinking, to my mind anyway, toward those issues. It's had its big stigma, but the stigma's gone.
Yeah.
The stigma should be
Definitely.
gone. We understand the drug very much.
Yeah.
We have our own endocannabinoid system. Early research shows people are low in certain amounts of that endocannabinoid system in fibromyalgia, anorexia nervosa, and it's hard to study, but I think we'll find it in many, many illnesses. If we top that up a little bit, they feel better, more normal.
Well, thank you, Bill. Dr. Code is writing his book, Winning the Brain Game. And like the MS Path with Terry Jacqueline ND Facebook page, and you'll be one of the first people to know about it and go into great detail about this. But in the meantime, it's certainly something that you can start to look for to relieve various symptoms, and not just symptom relief. It's providing a systemic benefit. So that's...
So if we've got just a minute,
Sure, absolutely.
the other part that it benefits, it raises the BDNF, brain-derived neurotrophic factor, which makes
okay.
more neurons and more connections
more
between
connections.
neurons.
Yeah.
And when you're in a healing phase, which I want MS people to be in, it's a good way to go there.
Nice.
So I'm going to talk about this in roughly an hour talk at the Canadian Neurovascular Health Society meeting in Vancouver. So if you go online, cnhs.ca, you'll see where that's hosted this year in Vancouver,
And that's in September.
September 23, 24.
Nice. Okay, great. Well, thank you again. And thank you all. And stay tuned, because I will be putting out a post as to what our topic is next week. And have a good week. Take good care. Bye-bye.
Bye now.